Welcome to this video on disaster risk management. We will be discussing evidence-based principles for healthcare leaders and emergency professionals, based on Ciatone's disaster medicine. As Ciatone states, the science of disaster medicine is a unique discipline. It requires specific operational and clinical expertise, going beyond emergency medicine on a larger scale. When defining a crisis, an emergency is an occurrence that local resources can manage. A disaster, however, disrupts and exceeds the affected community's capacity to cope. The defining factor is the imbalance of need versus resource. The disaster management cycle includes 4 phases. Mitigation reduces potential disaster impact. Preparedness involves planning, training, and exercises for an effective response. Response is the immediate action to save lives. Recovery focuses on restoring infrastructure and community emotional health. This continuous process informs resilient system design. The Hazard Vulnerability Analysis, or HVA, is a systematic approach to identify potential hazards. It evaluates their probability, risk magnitude, and the preparedness status for hospital operations. The pillars of preparedness involve non-structural mitigation and deep organizational planning. Key elements include robust supply chain redundancy, full-scale drills, community-wide communication, and policy-driven ethical frameworks. The Hospital Incident Command System, or HICS, uses a modular structure that adjusts to incident scale. It relies on a common language for clarity and job action sheets, which are predefined checklists for every role. Disaster triage principles shift the focus to the greatest good for the greatest number. Methods like START and SALT triage are used, focusing on immediate life threats such as airway, breathing, and hemorrhage control. Hospitals must manage the 4 S's of surge capacity during a mass patient influx: staff, stuff, space, and system. Surge capacity is finite, emphasizing the need for regional cooperation when limits are breached. Operational excellence is achieved through resource logic, transitioning to crisis standards of care when necessary. Command clarity is essential for integrating agencies. Strategic safety utilizes data-driven vulnerability mapping to prioritize risk mitigation. As Dr. Gregory Ciatone states, the hallmark of an expert disaster responder is the ability to adapt skills to the unique and often chaotic environment of a disaster. Thank you for watching this video. We hope this overview of disaster risk management has been insightful. The images used in this video were sourced from the providers listed here.